Hello, good morning, everybody. Thank you for taking time off from your weekend to come and join us today in our first of two webinar talks on clean movement. We believe that clean movement involves many different steps to help us prevent urinary or bowel incontinence. I'm Dr. Lim Jefong, and I'm the president of the Society for Continence of Singapore. Next slide, please. The Society for Continence of Singapore, SFCS, started from the dedicated work of a group of doctors, nurses, and rehabilitation specialists back in 1991. We are already 31 years old, and through the last 3 decades, we've been trying to do work to provide knowledge and support for all the sufferers of incontinence in Singapore. Our mission is to develop strategies, organize programs, and create awareness of incontinence, as well as to lobby the government, as well as non-government organizations to help to share resources and improve the support for incontinent patients. And we understand that this requires a multidisciplinary approach to healthcare organizations and continence care. And that is why today we have talks from various speakers with different specialties. Next slide, please. SFCS, I'm happy to say, we are currently an IPC status charity registered with the National Council of Social Services. We aim to restore the dignity of incontinence sufferers, and I hope you enjoy and learn from the webinar today. Next slide, please. So for today, this is the program that we have for you. The first talk will be about understanding and managing bladder incontinence. Originally, the talk is supposed to be given by Dr. Ronnie Tang, one of our EXCO members, but unfortunately, he has taken ill, and Dr. Shirley Bang, a urologist in private practice, will be taking over the talk. I believe she's from the Advanced Urology Group, together with Dr. Tan. The next speaker will be Miss Rachel Tang. She's a physiotherapist with Physio Down Under, and her area of specialty is in pelvic floor rehabilitation, and she will be speaking to us about bladder leaks, prevention and control using a simple exercise plan. The third speaker is an advanced practice nurse from Tan Tock Seng Hospital, specializing in continence care, Ms. Zhuo Guo Shuang. She's going to tell us a bit more about caring for patients with bladder dysfunction. The fourth speaker will be Ms. Maxine Ong. She is a product specialist from TENA. TENA is the largest provider of continence care products in Singapore and Asia. And then we will end it all with a bit of panel discussion to answer any questions from the audience. And with that, I would like to invite Ms. Dr. Shirley Bang to start her talk on understanding and managing bladder incontinence.
Okay. Good morning, everyone. I'm Dr. Shirley, a urologist in private practice. So these are some of my contacts where you can find me. So today I'm going to talk about understanding and managing bladder incontinence. So I'll keep it simple and fast, and hopefully you just take the pertinent points from the slide. So I think overall we know that urinary incontinence is underdiagnosed and underreported. Actually exerts major psychological or psychosocial effects on the society and the individual. It's more common in female, obviously, because of the pregnancy and delivery. Why we don't talk about it as much as we wanted is because actually incontinence is an indirect demonstration of lack of self-control for the women. So most women, they don't talk to the family, they don't talk to each other, so they just keep it to themselves. And of course, some of them have advice from their elders and say that this is just a normal part of aging. You know, you deliver 3 kids, 5 kids, of course you will leak. You know, just do some Kegel exercise from the YouTube, or you know, and don't waste money, see the doctor, they can't do anything. And these are some of the common things that my patient actually tell me. So it takes a lot for them to actually step forward and to see us. So there are many types of urinary incontinence, stress, urge, or commonly known as overreactive bladder. And there's mixed urinary incontinence is very common, and you have overflow urinary incontinence. Overflow is generally happens in patients with neurological conditions like post-stroke, any spinal problems. So I will talk about the two most common urinary incontinence that we see, stress as well as urge. Okay, so stress urinary incontinence, as the name suggested, is you leak urine, involuntarily leak urine when you exert yourself, physical exertion, usually some sport activity, sneezing or coughing. One of the most common presentation is a woman in their 40s when they start to want to get healthy and they want to lose weight, and then suddenly they go for this crazy gym workout and trampoline jumping, and then they engage some physical, personal trainer, and then they realize that, hey, how come they are leaking, So these are some of the common presentation lah. Okay, so the common causes for female, as we know, pregnancy and childbirth, where our pelvic floor support is being put to the test. Of course, postmenopausal estrogen lost. So one of the very common thing also, they started to realize that worsening of incontinence once they hit menopause. Of course, a small proportion of patients will be after pelvic surgery. Also, basically, the main thing is something to do with a weakened pelvic floor support. Then, of course, also can happen in male, although less common, because the continence support for male is more well supported if compared to female. So if it happens to male, it's usually they have to go through some kind of surgery, a therapy to their prostate area where the sphincter is being affected. Okay, then the other most common urinary incontinence will be the urge. That means you leak urine when you have the urge to pass urine. Yeah, so when you have the urge, you can't reach the toilet, or maybe you go to the toilet and then there's a queue and then you start to leak. So this happens when your bladder is being very sensitive. So it's not physical exertion to the bladder, it's when you have the sensation to pee. But very common, actually more than 50%, most patients, especially women, they have a combination of both. They have stress and they have urge as well. And that's when we call it mixed urinary incontinence. Okay, so when do we start to see a specialist or urologist? Of course, when you, for no reason, and then you start to have very frequency, urgency, or you start to leak. Actually, the first thing to do is to make sure that you have no organic causes, which is urinary tract infection or any stone. Of course, if you have been having incontinence for 10-20 years, and then suddenly you decided to see a urologist, most of the time, there's no organic causes. Then you can see us when it starts to affect your quality of life. It stop you from doing things that you like, stop traveling, embarrassed in front of your friends, or you start to wear more and more incontinence pads, and you're very young and healthy. So then you should come and see us, because we can do something to help you. Okay, so when you come and see a urologist, what do we do? Of course, number one, we need to examine you and make sure that there's no organic causes. It means there's no UTI or stones or any cancer or things like that. Most of the time, it's normal. So the test that we do will be, we'll check your urine analysis, we make sure that there's no infection, we'll do a bedside ultrasound of your kidneys and bladder, and we'll check the urine flow and any residue urine. Residue urine meaning after you pass urine, how much urine actually left in the bladder. Then we will check your pelvic floor muscle strength. There are some other tests that we do, is mainly the principle of urologists will be, we will see what kind of incontinence and how bad it is. Then it will determine what kind of treatment regime that we will suggest to you. Okay, then there are some more specialized tests where we call Neurodynamic Studies. This one is an office procedure, and usually we do this before you go on to some surgical treatment, because SUI, if you remember, is stress urinary incontinence. It's very different to overreactive bladder because of the treatment differences. So it's very, very important for us to do certain objective tests to determine the kind of urinary incontinence that you have. So I won't go more into this. So you can see that the two, just go too fast. Yeah, so the two urodynamics tracing of stress and overreactive bladder, it looks completely different. So this is for us to determine in what situation you leak urine. Then it will help us to differentiate the two types of urinary incontinence. So why is it important before surgery? Because once you do surgery, most time it's irreversible. So we want to make sure that the surgery gives you the best outcome. Okay, so how do we treat stress urinary incontinence? So we always go from basic to surgery. So non-invasive to invasive. So non-invasive, as we can see, there are some lifestyle modification. Maybe don't hold your bladder, maybe drink less of caffeinated drinks. Pelvic floor exercises and biofeedback, I can't stress that it's very, very important. And usually I would suggest that my patients go to a proper physio to do it rather than watch YouTube. Because if you do, if you go to a physio, they'll teach you the correct method. You know, they'll make sure that you're doing, you are contracting the correct muscle. And of course, it gives you, it will emphasize self-discipline a bit because you have to do this real regularly and to see the outcome. And if you do it correctly, this is all well known, that scientifically proven that it will give you improvement. Okay, so for stress urinary incontinence, there's no good medication to treat this, because as we know that it's due to pelvic floor weakness. You cannot take medicine to increase the tone of your pelvic floor or to suddenly, bulk up your muscle. So there's no way. So you have to do exercise, no shortcut. Then for some patients, obviously it's so weak that even despite any kind of exercise or pelvic floor and all that, can't improve the incontinence, then we have to do surgery. Okay, so this one, as I mentioned, that maybe I'm sure Rachel will talk about it more later. So then I'll go on to surgery. So when pelvic floor exercise does not work and it's very, very severe, then we have to do this to help you. Okay, then this from minimally invasive to more invasive. Deflux is it's bulking agents that we inject into your urethra so that we can close or narrow the urethra. Usually for deflux, we may be offered to older patients where maybe they're not fit for major surgery because it's not a permanent solution. You need to come back for repeated injection. So usually we don't really do this much anymore because, as we know, the incontinence patients nowadays, they are very active, very young, very active. So they want something more permanent. Then we come to the somehow gold standard for female female incontinence. It's where we actually put in a mid-urethra sling. There are many, many kinds of the ways that urologists or urogynecologists, we put in our tape. I think they are all as good. It all depends how comfortable your urologist or urogynecologist. So they will choose the method that they're most comfortable. Outcomes are all good. And usually continence will be reported more than 90% success rate. Can be day surgery, but usually I keep my patient overnight. Then there's a subset of patients where, if let's say they cannot take artificial sling, like very severe uncontrolled diabetic patients, or they're taking chronic steroids, or they have done their sling many, many years ago and now failed incontinence again. Then we actually have to harvest your own muscle and fashion it into a sling, and then we do a surgery to put it in. Okay. Then for male, most of the time they leak after robotic prostate surgery, where the sphincter is being compromised. So we can offer, for the mild to moderate male incontinence, we have something of a male version of a female sling. Okay, so also minimally invasive, where we put the sling in to recreate the coarctation of your urethra, because your prostate is gone, your sphincter is gone. So this sling will be in there to recreate that angle to help you with your continence. Then, of course, we have the most maximum invasive, or rather gold standard, where usually it's after prostatectomy, then they go for some radiotherapy and they leak. Even when they stand up, they will start to leak. Then we will offer artificial urinary sphincter, where they have to we have to implant all this. And when they want to pass urine, they'll squeeze the pump and the cuff will open and they'll pass urine. Okay, then I think then we come to remember that there's the other kind of urinary incontinence, which is urge or overreactive bladder. So if you remember, for stress incontinence, the main purpose is to improve your pelvic muscle tone. And if that doesn't work, we use surgery to help you. But for overreactive bladder, of course, we have the non-invasive of lifestyle, pelvic floor exercises, bladder training. But the mainstay of treatment will be medication, because we need to stabilize your bladder. So I will just skip this part. The mainstay of treatment will be medications to block the receptors of your bladder contraction. So the older agents has a lot of side effects, but the newer agents, they are more targeted to the bladder, so less side effects. Some group of patients are not very suitable to take these medications because it does affect their cognitive impact, especially patients with Alzheimer's. We are very cautious in prescribing this medication to them. So some of the common side effects: dry eyes, dry mouth, blurred vision, because what happens is they block the receptors in the bladder so that your bladder is stable, but at the same time, some of the receptors in your tear ducts, in your salivary glands, are being blocked as well. So you have a bit of these kind of side effects. Then, these are the newer agents where the first line would be to block the contraction. Then you have medication to induce relaxation. So different profile of side effects. So your urologist will determine which medication is more suitable. For example, if you have high blood pressure, then maybe the beta 3 agonist is not suitable. So your urologist will decide which medication is the best for you, and then we usually try, and sometimes we combine two as well. Okay, then if let's say you're not suitable to take medication or a lot of side effects, then you have PTNS, which is where we use a percutaneous stimulation of your tibial nerve. So what happens is that when we stimulate the tibial nerve, you send signal to your spinal nerve roots that control your bladder. So it's a form of bladder rehabilitation. The only problem is you need to be very compliant and some time loss, because you need to come weekly, 30 minutes for like 12 weeks to see the effectiveness. Of course, the more severe group where everything doesn't work, so sometimes we have to do sacral nerve root stimulation, where we implant directly to the nerve roots that supply your bladder. Not commonly performed here because it's quite invasive, but certainly an option. And then we come to Botox. The Botox is the same Botox that you inject to your face. Instead of that, we inject into the bladder so that it will help the bladder relax or calm down. So it's quite effective. The only thing is, same as the Botox to your face, you need to come back 6 to 12 months, depending on your response, to repeat the injection. But the procedure itself is minimally invasive, where we put a scope up and then we inject into the bladder. Day procedure, so it's easy to do. The only thing is that you need to come back repeatedly. So in summary, there are two main kinds of urinary incontinence. Just remember, if you leak when you cough and sneeze, will be stress. And then when you leak, when you have the urge to pee, will be overreactive bladder. Actually, I missed out that for the younger group of patients, when they leak right after delivery, or when they have not completed their family, we sometimes do offer Vagina Laser, which is an office procedure where we apply laser or heat phototherapy to the vagina tissue so that there's collagen remodeling and hopefully it will tighten the urethra tissue as well. So the good thing with Vagina Laser is it's an office procedure, 30 minutes, you come, you do, and then you can go, no time loss, 2 sessions standard, 1 month apart. And the disadvantage is that this is also temporary, depending on the individual's collagen quality. Some will have, you see the benefit for 1 year, as long as 1 year. The good thing is that if, let's say, it recurs, you can just come back and redo the sessions. But for older patients, postmenopausal, you completed your family, your leak is fairly severe, usually I would suggest you just do surgery, and which is for a more permanent solution. So I think my advice is that Number one, you try not to avoid this problem. It is a problem. You recognize it. You know, there are treatments, and it's not a natural process of aging. Like, oh, my bladder is weak. There's nothing I can do. And then just take the first step and see us. It's not embarrassing. Then we will refer you to the necessary people, physiotherapists, and all that. We will help you. Yeah. So you don't compromise. Oh, I will just stop dancing since I'm leaking. No, we shouldn't compromise. Okay, there are things that we can do. Okay, so I think that's my last slide. Hopefully I catch your attention enough. Thank you. So yeah.
Yep, thank you, Shirley. We'll just leave this slide up just for a while.
Okay.
So that if anybody is interested to find out more about speaking to a urologist and how they can handle their urinary incontinence, you may contact Dr. Bang at one of these clinics. There are also many specialists, urologists, who are volunteering with the Society for Continence in the public hospitals as well as different private hospitals providing this service. You may find their names from the various hospitals, or you can check the Society for Continence website for the information. Thank you very much, Shirley, for your insights.
Thank you. Thank you.
I would now like to introduce the next speaker. The next speaker is Ms. Rachel Tang. Ms. Rachel Tang is also a board member of the Society for Continence. Her area of specialty is in pelvic floor rehabilitation, and she's going to share with us about bladder leaks, prevention and control using a simple exercise plan. I'd like to take over, Rachel.
Okay, thank you so much, Dr. Lim. So good morning, everybody. Thank you for joining us this morning to learn a little bit more about incontinence and what we can do about it. So as they've already spoken, I will talk about bladder leaks and prevention using a simple exercise plan. So a little bit of an outline of what I'm going to cover today. So I'll just kind of breeze through and reinforce what Dr. Bang has just talked about. And which type of incontinence can really be helped more by exercise. I'll be covering a little bit about the pelvic floor. I'm sure you've heard a little bit here and there, but maybe not everybody has an idea what is this elusive muscle that everybody has that controls my urine, controls my bowels, but we don't usually look at it. We don't really think about it. And also how we can start a little bit of a simple exercise plan. And who do you look for help? You have no idea what you're doing or whether you feel that, okay, maybe there's something that's not quite right, yeah? So again, we're going to talk about the types of incontinence. There are actually, as she mentioned, the three main types. I will just talk about a little bit more about the functional. So there's here overflow. So overflow incontinence, as she mentioned, is usually a little bit more of a medical thing. Both males and females can actually have this issue where it's normally caused by urethral blockage and the bladder is unable to empty normally. The second is the urge incontinence. These are the ones which really sometimes are really, really bothersome because they're the ones you have a sip of wine and then you're like running to the toilet and pushing people out of the way. And then some people have really that strong urgency, but it can come with or without leakage of urine. They are still caused by really similar mechanisms, but both actually can be kind of rehabbed and helped along the way. You don't have to live with it just because you're not leaking and think, oh, I'm not leaking, but it's really, really urgent. There's nothing much I can do with it. That's not true. So stress incontinence, as she mentioned just now, it usually is caused by things like laughing, coughing, or just after childbirth when the structures around the pelvic floor, our bladder, our vagina are a little bit more loose after having vaginal birth. So it can happen to those with cesarean births as well, but as long as it's caused by a mechanical meaning something that we're doing, something we're coughing, laughing, jumping on the trampoline, and is associated to leakage, it will be considered stress urinary incontinence. The last one also that I will talk about is just because, you know, I'm a physio, we talk about moving all the time. So functional incontinence is where people don't necessarily have issues controlling their bladder, but they end up having stuck in a chair, stuck in a wheelchair, stuck in bed because they broke their leg. So things like this, right? Exercise also can help, not necessarily pelvic floor, but different types of movement therapies can definitely help for you to get to the toilet in time. So I just want to do a quick poll about what people think which is the type of incontinence that can really, really be helped by exercise? So I've just started the poll. So the question is, what type of incontinence can exercise help? So it doesn't have to be like gold standard, okay, everybody, just kind of put in what you think so I know where everybody is at. So do you think exercise can help with overflow? Do you think exercise can help with urgency, stress, urinary incontinence, functional, or all of the above? Stress incontinence, yeah. That's the main one, which everybody knows about. Okay. All, yeah, yeah. Anybody else? All the above. All right. In the interest of time, I will just give everybody the answer, yeah? So actually all of them. So one of the reasons that does cause overflow incontinence is actually not necessarily weakness, but sometimes you have a little bit of tightness and tension. When that happens, you don't actually empty your bladder fully. So this is one of the reasons. They're not all. As Dr. Shirley has actually mentioned, there are a lot of other medical reasons that could cause that overflow, but having the capability to relax that pelvic floor and allow a full bladder emptying does help with overflow incontinence. So for urgency, the exercise does help, because one of the ways for you not to leak and one of the ways to control urge is actually to have a very good, strong contraction of the pelvic floor. So one of the things, if you can try, if you already know how to contract your pelvic floor, is when you feel that urgency, you breathe into your stomach, and then after that you squeeze your pelvic floor. And within a few minutes, if it's really not a really full bladder, you should feel that urge pass. For stress incontinence, because it is linked to sort of relative strength issues, exercise does help. And as I mentioned, for functional incontinence, if you get your legs stronger, get you moving better, it will not actually cause issues getting to the toilet in time. So exercise, I just wanted to mention, is not the do-all and end-all. It's not like, oh, I tried 12 weeks of exercise training, my strength is super, super good, but I'm still leaking in the toilet. This is not necessarily gonna always be the case where if you have a strong pelvic floor, you may not leak. There are a lot of different reasons why you could have leaking. And like just here, if you look, the first round, physical therapy, PFMT training, pelvic floor training is one of them. Exercise in different sort of areas to bring down weight gain is also really, really desired for urinary incontinence. And also other things like behavioral therapy. Are you hydrated? Are you getting enough water? Is your bladder and your habits healthy? Are you going enough? Bladder training also is all part of management of urinary incontinence. Pelvic floor training is just one part of getting you dry. So elusive muscles, I didn't leave the males out, yeah? So if you look over here on the left and in the middle, these are your pelvic floor. So imagine you're actually lying on the floor and somebody walks and stands over you. If they're not wearing any pants and underwear, this is kind of the image that you will see, yeah? If you took away a few of the muscle layers. So if you look at the colors, it's a bit confusing, yeah? How come the colors are exactly the same for the male and the female? Actually, the male and female muscles are very, very similar. So the only difference is that if you look at it, the one in the middle, the pink color, instead of being a muscle that contracts this direction, so for the penile shaft, it contracts in a more compressive manner to actually close up the urethra within the penis, as well as lift up the bladder. So if you look at it, the cues that we can use for males and females can be slightly different, but we are activating exactly the same sort of muscles. So for those that are anatomy geeks like me, if you strip away all the other bits, you look at the video, the green color, this is what happens when you have a pelvic floor muscle contraction. So it's not just a squeeze. What you have is a squeeze from the bottom with the sphincters around the vagina, around the anus, or around the penile shaft. And then you actually have a little bit of a lift towards your head. So you can really see and imagine from the bottom, it's a squeeze and lift, like having a bit of an elevator float up. Okay, so this is really important because this goes to the next part. what do you do in muscle training and what exercises are helpful? So number one, we have to identify the muscles. So just now I taught you, you identify, this is my pelvic floor. This is where it is, this is what it does. Then you have to have a correct contraction. So if you try now, pull up your pelvic floor. If some of you are bouncing up and down on your chest, not right. You're not getting correct isolation. You're using a lot more muscles from the other areas. If you
Nothing, me.
Sorry, if you contract and you see you're moving up and down, if you're standing, your tummy is going in and you're sucking in and you cannot breathe, that is also not right. Because if you cannot breathe, you're obviously going to pass out. Urinary incontinence is going to be the last of your worries. Thirdly, the next step is to improve. So maybe you can do a little bit of a contraction. You're like, yeah, I only feel a little bit, but I cannot hold. I just feel like I cannot hold. Improving means that you practice until you can hold for longer periods of time and also for every single action that you need. For example, if you leak on the trampoline, you'll want to kind of improve that muscle to be strong enough to withhold your body weight as well as that pressure of jumping up and down on the pelvic floor. And that leads to functional integration. So what? Okay, I do a lot of exercise. I can do it on the bed. I can do. But then how come when I walk to the toilet, I carry a little bit of groceries. Wow, today NTUC very, very cheap. Then I buy 2 liters, 3 liters, and then after that 1 5-kilo watermelon. Then you walk back, then you leak on the way home. Yeah, so that just tells you that your integration within your function may not necessarily be correct. Okay, so let's practice a little bit. Everybody, we cannot really see what you're doing on the bottom, so please practice. Nobody can see what you're doing, no need to paise. The first one for identification is you can actually put your finger just between your butt cheeks, and then you want to feel, where is my anus? You want to tap piku, right? Where is it, that area? When you practice, you want to feel a little bit of a tightening and a relaxation without bouncing up and down, yeah? That's one method. Another method is to use a mirror to look. So for men, what you'll actually see is you'll have a very gentle scrotal lift. For women, you can actually see there's a little bit of a lift within the vagina or the anus will come up. The third method is if you put your hands underneath your buttocks and you feel, not for the anus, but for your sit bones, you scoop in between, you stretch, you should feel a little bit of a contraction and a relax. It's not a very, very big movement. You shouldn't be feeling like your whole backside is moving up and down. It's really very gentle, like somebody is just from putting some pressure to letting go of that pressure. That's what you should feel. Another point is you can poke around onto the tailbone, which is you put your hand behind your buttocks, slide down just before the anus. This one will pull forward and back. The easiest one actually is really to do the urine stop test. This is to just identify the muscles. We're not asking you to train while stopping urine. That will actually create a bad habit. But just to know, which muscle is it? Am I doing it right? You will actually try to stop your urine mid-flow. Then you know, okay, this is the muscle. But please don't practice stopping your urine mid-flow. Okay, you practice after you finish your urination, void it fully, and then after that, you practice sitting, standing, lying down. All right. The last one, which is kind of fun, but does need a little bit of therapist help, is singing. So some people, when they go, ee, you can actually feel, how come everything is coming up? And then you go like, you actually feel everything relax. So these are nice ways that you can identify the muscles. Some other cues would be elevate the bladder, stop the urine. For males, nuts to guts, testicles away from cold water. Imagine your shaft is a turtle in a shell. Shorten the penis to stop the flow of urine. For fecal incontinence, for bowel control, you want to always think gas holding back or anus upwards, tailbone towards the penis or pubic bone. For women, you'll be thinking about stopping gas, stopping urine, pulling into the vagina, or moving the clitoral head. So there are lots and lots of different ways that you can actually practice and try to get it right, yeah? So just now I mentioned when you do those exercises at the start, you want to make sure that you're nice and relaxed. You're not like breathless. Your tummy is not going in really tight. There's no buttock squeezing. You're not squeezing your thighs. You know, like when you're a child, right? You want to rush for the toilet, but then there's people in the toilet and you squeeze your legs tightly, close. That is not the right way of doing pelvic floor. It's very good to get very nice toned legs, but it's not so good for training your pelvic floor. The last one, which is very common, is don't hold your breath. So you feel, oh, I can squeeze. And then after that, you're like, hey, why are we here now? Why am I a bit giddy? A lot of people hold their breath. So a trick I usually ask people to do is that when you practice, you want to continue talking, or at least you want to count out loud. So there's no choice. You need to talk through and don't breath hold. The next step for the third eye is to improve. So after you know, wow, I can get it right, not a problem. You want to actually practice the slow contractions for endurance. So you hold it for 10 seconds, up to 30 seconds for the external, which is the anus, and relax the muscle. Okay, so you will want to kind of repeat your longest hold. So let's say today I can only hold 2 seconds. That's perfectly fine. You practice 3 times a day, 2 seconds in all positions, and then you build it up. And slowly you will feel within the 6 to 12 weeks, you'll be able to hold for longer and longer. So that's for our endurance. For the fast contractions, this is really, really important for some stress urinary incontinence related to coughing, to sneezing. Nowadays, it's really, really common because with COVID, everybody's coughing for long, long periods of time. We're seeing this in the clinic where, you know, you cough 1 time, you cough 2 times, okay. Then you cough for the next 10 to 15, you get very big leakage. This is because our fast twitch muscles don't either act fast enough or don't have the endurance for those many, many coughs. So what you want to practice is to pull up and relax, pull up and relax. So for example, I show you on my bicep. So if we're doing a slow contraction, right, you'll be squeeze, and then relax. For the fast contractions, you'll be doing squeeze, relax, squeeze, relax, squeeze, relax. So it's a very different sort of muscle that you are actually kind of training up, okay? So it's not so straightforward, just do one exercise only. The last one, which is the functional progression, I don't expect everybody to do number 3. Those with back problems, please don't try this at home. So you will start gravity assisted with a little bit of hips up, especially for the ladies with prolapse. It can be more easy if you kind of lift the hips up a little bit. Second would be flat. Third would be gravity assisted. Fourth would be standing, squatting, and jumping. So just so you know, those people that only lay on the trampoline, this is the biggest and hardest exercise for the pelvic floor. So if you only leg, then you might on the assessment be actually not very, very weak. It might be the coordination of the muscles and a bit more of the training on when you land and when you jump. So for 1, 2, 3, 4, 5, that is really like the basic training. For number 6, to be able not to leak for like an hour of trampolining, that would take all the other muscle training as well, not just pelvic floor. So to summarize, today's talk was really to know where your pelvic floor is, how do you move, how do you contract, and how to relax. The second point is to really work on it consistently. So people are like, yeah, I tried for about 1 week, 2 weeks. I see no difference. Do for what? You have to understand when it comes to muscles, it's really about consistency, and the muscle strength only increases in about 12 weeks. So your strength, maybe you see some effects if you really practice 3 times a day, 2nd week, 3rd week. Really not so bad. I can cough 5 times, but not 10. You want to see hypertrophy, muscle become bigger, 12 weeks. And lastly, please do seek professional help if things don't feel right or not getting the effect that you desire. It may really be other contributing factors like I mentioned, which is like, for example, if you have overflow, you're really, really strong, and then after that you end up not emptying. Whatever you do, you might still get that incontinence, because we have to figure out, and medically the doctors and the urologists that will review you will make sure you don't have a structural blockage. For the other issues, I really have to see what everybody's sort of body type is, as well as how they are moving. Everyone is really a little bit different, Not everybody's face looks the same. Our wrinkles all go differently as well, even though our twin do exactly the same thing. So you really have to assess and treat. I cannot say enough. Assess before treating. Not a one-size-fits-all thing for everybody, So for extra help, I really don't mind, as Dr. Lim mentioned, reaching out to me to ask questions and simple questions. You may not necessarily have to see me for sure, but I would love to actually help you on your journey to find out, especially in the public setting, who you can reach out to, as well as how to get extra help if you do feel that this is one area that you really would love to put in a little bit more effort in to help with any urinary incontinence, fecal incontinence, or even defecatory disorders. Defecatory disorders meaning constipation, unable to poop easily, okay? So, and with that, I would like to finish off and thank you again, everybody, for your attention, as well as the people who have kindly invited me here today.
Thank you very much, Rachel. To all of in the audience, I hope you learned a little bit about how you can do simple exercises at home to teach you to identify the muscles in your pelvis that help you control your bladder and bowel, and how you can strengthen them. As you can see in this slide, you can contact Ms. Rachel Tang at the email addresses below. The Society for Continence also engages many other, like nurses. We also have many physiotherapists who volunteer their time to help with patients. And if you're in doubt, you can approach Ms. Tang, and she can also advise you on who you can contact in the public hospitals. You may also contact the Society for Continence for the information. And I want to reiterate what Rachel has just mentioned. Exercise is important. And as a doctor who deals with bowel control, I will tell you that exercise is useful for all versions of pelvic floor weakness and all versions of incontinence, because a person rarely has a very strong pelvic muscle yet leak. And if you are leaking, your muscles do need a little bit of help. Okay. And with that, I'd like to hand over to the next speaker. The next speaker is Ms. Zhuo Guoshang. She is an advanced practice nurse at Tan Tock Seng Hospital dealing with continence care. And she's going to share with us a little bit on caring for patients with bladder dysfunction.
Hi, can you see my slide?
It's good.
Okay, hi. Good morning, everyone. My name is Guoshang. I'm an advanced practice nurse from Tan Tock Seng Hospital. So, so my topic was care for patients with bladder dysfunctions. When patients have bladder dysfunction, they can present with like urinary frequencies, urgencies, or urinary incontinence, or even retentions of urine, meaning that they cannot pass urine, and they were presented to the doctor. This can occur in both men and women of all ages due to different causes. Therefore, before being referred to the nurses, the doctor would have evaluated what is the cause of these urinary issues. And then it's also often being commonly seen in women and older adults. So do I have a bladder dysfunction? Today, I'm going to walk you all through with two cases that is commonly type of cases that is commonly seen in our clinic. So to help at the same time, also discuss the management for them. So Mr. Tang is a 56-year-old gentleman. He works as a delivery driver. His weight is around 75 kg. His main complaints to the clinic was urinary frequencies and urgency. He also noticed that he's passing urine more frequently than his peer of his same age group. Like what he shared with us is like he says that, oh, when I go for a lunch gathering with my peers, then I need to go to toilet like 2 to 3 times instead, where my peers does not need to visit the loo. Otherwise, he did not share. He shared that he does not have any urinary leakage. So we will actually advise our patients to do a voiding diary, also called Bladder Diary. This is also an assessment tool that requires them to do 3 days of the recording of the fluid intakes that they take and the amount of urine passed for 3 days. These tools is very useful for us, be it the doctor or the nurses or even the physiotherapists, to provide us with a lot of information of the patient's passing urine habits and how their bladder behave, and then the drinking habits also. So for the recording of the diary, we'll teach them how to go about recording. Usually we'll ask them to record at the start of the day. Do not start at midday or like towards the end of their day, because we want to know how much fluid they drink and the type of beverage they take throughout the day. And also we advise them how to go about recording and use the chart, because we want them to record the amount of urine they pass each time rather than accumulated over like 1 or 2 voids, so that we know how much is the voiding patterns from the bladder. So a normal bladder functions, right? Generally for a normal adults, their bladder functions can hold up to 400 to 600 ml of urine. Then they will need to visit a toilet 6 to 8 times a day, depending on the amount of fluids they drink. Nighttime urination, right? Commonly, normal people can sleep throughout the night, but sometimes we need to wake up 1 to 2 times, which is also normal, or they need to visit a toilet with an interval of 2 to 4 hours. So let's look at Mr. Tang's bladder diary. This is a diary that he has provided us during the next visit when he returned to us. So he actually, based on the record itself, it shows that actually during the daytime, he needs to go to toilet 7 to 8 times. It appears to be okay, because like what I shared, the normal functions. Then nighttime urination, over the 3 days, we have 1 to 2 times. Then the amount of fluid intakes that he takes is around 1.2 liters to 1.4 liters. Based on his weight, we did realize that the amount of fluid that he drinks is a little bit lesser than required. So with further probing, he actually did share with us that because of the frequencies and the nature of his job, he does not want to drink so much water, so that he does not need to visit the toilet so regularly. Based on the chart itself, you can see that each time when he went to the toilet, the minimum amount he passed was around 70 ml, and the maximum volume that he passed was around 270 ml, which like he can hold up to this volume, and he has this urinary urgency. Then otherwise, there's no urinary leakage based on the chart, which he also did share that he did not have any urinary leakage. So is this a normal bladder diary? I mean, based on the chart and the frequency itself, is okay. But because the fluid intake taken was a bit too lesser, which we actually will recommend to do some lifestyle modification, and we also advise to do on the benefit of bladder training for him. So the purpose of bladder training is actually we will advise to our patient with urinary urgency and also complaints of urinary frequency. Reason behind is because our bladder actually can hold a good amount of 400 to 600 ml of urine. We do not need to void at urine at around 70 ml or 240 ml. So based on this chart, I can advise Mr. Tang that actually based on the small urge that he has, like at 70 ml, he need not need to go to the toilet. He can go to toilet at a stronger urge, like 270 ml if there's a need, because he need to travel on the road. But apart from that, actually he can learn to stretch the bladder and then hold the urine even more, like up to even 400 ml or even 500 ml, because he doesn't have any urinary leakage. So at the course of the advice for bladder training, we will teach our patients how to use relaxations or distraction therapy to postpone the urinary urge. Also with the help of pelvic floor muscles exercise. So the relaxation part of advice, we will ask the patients to like stay calm, do deep breathing exercise, so that actually it also can help to the anxiety of rushing to the toilet, and then also try to weaken the urge that they need to void. So apart from this, the distraction therapy wise, we will ask them to do like some mental calculations to defer the urinary urgency. So it's also important, we always ask them, you need to know what is a small urge and what is a strong urge. The amount that voided actually will tell you whether is it a small urge or a strong urge. So with this, we also want to, while looking at the bladder diary, we want to increase the time interval. If he's passing urine at 70 ml, like for example at 8 o'clock, then the next void is at 9:30 with another 100 ml. We will advise them this 2 void is not needed. You can stretch a little, and then maybe you can postpone the urinary urge a lot, like to 2-3 hours later, and then to pass urine. So at the cost of bladder training, right, we do not want them to do it at work or at work like his job, because it can be very dangerous. Like being a delivery man, he needs to travel on the road. So he may not be able to stop his car when he has this urinary urgency. So we advise them to do this bladder training usually when they are on their off days, or so that to see how it works, and then to also repeat the charting. So some of the patients who also complain of this urinary frequency, they can go toilet every 2 to 3 hours or even 4 hours. So sometimes we will do prompted voiding. We ask them, can you hold up to 4 hours or even 3 hours? If you cannot hold, so to remind them to go toilet, because some of our patients can be also like elderly patients with medical conditions that they have like forgetfulness. So with our prompted voiding, right, we will tell them to like, oh, you have not been going to the toilet for 3 hours or even 4 hours. Do you want to pass urine? So that to prevent accidents of like urinary leakage. Or in elderly, we also will have some time voiding schedules for them to go toilet at every like 2 hours or 3 hours interval with an adequate amount of fluid hydration. So we talk about a lot of lifestyle modifications in bladder training also, or even some lifestyle modifications to help with your urinary symptoms. So for fluid management wise, for a normal adults, we need to drink at least like 1.5 liters to 2 liters a day, unless you have medical conditions like heart failures or even kidney failures that you are not allowed to drink. So you have to keep to the fluids that of 1 liter a day or even lesser based on your doctor's prescription. So while you are doing bladder training, we also advise patients not to take foods that actually irritate the bladder, such as like caffeinated drinks or carbonated drinks or alcoholic drinks, because normally every individuals may have different practice. Some patients, they may drink like teas throughout the day or 3 to 4 cups of coffee, and it has these urinary frequencies and urgencies that may cause leakage. So we advise to cut down the amount of caffeinated drinks or alcoholic drinks or carbonated drinks while doing bladder training. And then spread the fluid across the day. Do not drink a lot of fluid, all focus on the day, day itself, or throughout the night, so or at the night. So we will just spread the fluid across the day, so that also will help to reduce the nighttime urination. Then stop drinking 2 to 3 hours before their bedtime, so that they can sleep throughout the night and do not need to wake up to pass urine. Having a good quality sleep actually will let you have a better day to start off the next day or on the next day. So urinary symptoms also can associate with constipation. So we need to focus on bowel care in adults or even older adults. Sometimes a very severe constipation can cause them to have difficulty urination or unable to pass urine. So the tips to like avoid constipation, sometimes you can drink a cup of beverage with caffeine in the day, and it helps you to have some bowel movement. And also when you have these signals to go to the toilet for your bowel movement, do not ignore the urge, because if you ignore the urge longer, then the signal may get weaker, and then you don't have the urge to pass motion again. And for individuals, it's recommended to have actually a good amount of fiber intakes for around 20 to 35 grams per day. These food are easily can be obtained, such as like taking apples of 1 portions of fruits with like vegetables like broccoli or carrots, and or even like wholemeal breads. So I think a good amount of high fibers will also avoid constipations in individual. So next, some patients who complain to us like nighttime urination, we need to find out whether it's the sleep quality that is poor, or like sometimes they say that they're unable to sleep at night. Then that's why they need to wake up to pass urine. So it's important to know whether is it that the sleep that is affecting you, versus that the urinations that have to wake you up to pass urine. So if it's the sleep quality that is affected, or like there's some sleep disorder, we will also tell our patients, actually it's important to have a consistent sleep schedule, that you go to bed regularly at night at a certain hours and wake up on a certain, at the same timing of the day. Then also ensure that bedroom environment is conducive, it's not noisy, and make sure it's the lights is off, so that at least they can sleep well and the room is not too hot, and maybe make the room cooler. Also avoid taking short naps, especially in older adults, because at night they can't sleep well, so they will tend to take some short naps in the afternoon. If you really need to take a short nap, try not to last for more than 30 minutes. Also relax your mind before you sleep. Do not use a lot of gadgets that nowadays we used to have very handily, such as your iPad or phone before your sleep, 1 to 2 hours before your sleep. Also avoid heavy meals or caffeinated drinks before your bedtime, so that you can have a good sleep and then you do not need to be awakened by the nighttime urination easily. Next, I'm going to share a bit about the second case that we also quite commonly see in our clinics. This Madam Lim is a 35 years old lady who just had delivered a baby 2 months ago. Currently, her postnatal weight is 78 kg. She complains of this like occasional urinary leakage when she sneezes and coughs in the past few days. So otherwise, she does not complain of any urinary frequencies in the day or nighttime. So this is like what we commonly see, and this also what we say is a stress incontinence. So this is Madam Lim's Bladder Diary. You can see that the daytime frequency was 6 to 8 times, and then she drinks around 1.6 to 1.8 liters of fluid a day, which is sufficient for her. Because currently she still stays at home. She does not do a lot of activities that require to sweat. Or then the minimum voided volume amount was 90 mils. Maximum voided volume amount was like 480 mils. But most of her each urinary void is actually around 250 or even to 310, which is adequate. So she did complain that she had one urinary episode, which is when she holds the urine of around 480 mils. She coughed and sneezed and she had some leakage. So it is also important to have this weight management to our patients, and then we also advise to go stay within a healthy body mass in that, like so not being too overweight. A healthy weight actually avoids big like excess pressure onto your pelvic floor muscles and bladders, so that you will not have this urinary urgency and frequency. So if especially with some weight reductions, your patients with stress, urinary incontinence like leakage, we actually will see some improvements in them with some weight loss and pelvic floor exercise. So it's important to maintain your weight within a healthy range, and also to stay active. Okay, sorry. Well, yes. Okay, so like for her management will also be pelvic floor exercise, which sometimes for a nurse, urology nurse, we also teach the patient how to do it. If we notice that on this they are unable to perform the exercise, we also refer them to our continence physio, so that they can have more sessions with the physios to correct the exercise. Okay, and definitely with pelvic floor exercise muscle training, the stress incontinence, urge incontinence can improve greatly with bladder training. So sometimes for absorbent, we also recommended some absorbent products such as incontinence for these patients, because patients may have this urinary leakage from mild to severe. So we are also advised on the type of appropriate urinary incontinent pads to use. Whether for small leakage, we will advise them to use some pad. Because some of our ladies who presented to us, they actually did complaints. They have this urinary leakage, and then they use the sanitary pad to contain the leakage. So sanitary pad is not as absorbent as incontinent pad. And with this, right, if the patient remains moist and wet, this can also cause result of urinary tract infection and some odor. So we also advise them to use the appropriate continent aids to help them with the continent leakage while they are doing the bladder trainings and pelvic floor exercise. So there are complications of like urinary leakage, such as like incontinence associated dermatitis, where some of the patients may require diapers, and then due to prolonged exposures to urine and stools that was not changed regularly, they can result in skin rashes or broken skin. So we also will educate our patients or caregiver. They need to change our patient's diaper promptly. When it's wet, we cannot wait for it to be soaked, then we change, or wait for like the whole morning. After the whole morning, then we change. If the patient drinks more water in the daytime, then we need to actually start changing the diapers once it's wet, like as a less intervals of 2 to 3 hours instead of 4 hours. Okay, then we also will advise them to use some barrier cream to prevent, to improve the skin integrity, to prevent like ulcers or rashes or broken skin. So urinary tract infections can also be a result of urinary incontinence. So we also advise them to change their pad and diaper when it's soaked, and then do not save on the use of incontinent pad, like such as like putting tissue paper inside the pad and then remove the tissue paper after it's wet, and then just keep onto the same continent pad. So if you want to use an incontinent pad, we will tell them just use it and then change it regularly, and then use the appropriate size so that it will not be too costly for them either. So there are also external factors that cause an individual who cannot reach the toilet in time, such as environmental or individual's functional status. So environmental issues will be like, you need to identify whether is there any obstacles, like you can't reach the toilet in time, although you have a good bladder functions, because sometimes like there's no toilet accessible in the area that you are trying to reach for. Like for example, you're on the road, or there's no toilet in your bedroom, so like you need to go to second floor of your house to go for the toilet, and you can't reach them in time. So these are the factors that you need to identify, and will assist the patients to modify their urinary habits to avoid this urinary leakage. So for functional status, right, sometimes it can be due to your gait or your functional, your skill, fine motor skills that you cannot do it. We also advise them like there will be some alternatives of, instead of going to the toilet, I'm going to talk about the next one will be like use some toilet substitutes, use of bedpans or urinary urina for patients who cannot reach toilet in time or have difficulty ambulating to the toilet. So they have to use this, consider the use of this, and then we advise them how to go about getting it and the use of it and how to care for them. So for patients who need to wake up frequently at night or go to toilet during the daytime very frequently, we also advise the use of bedside commode, because not all patients is suitable for diapers, but as long as they're still continent, we still want to avoid the usage of diapers, then we will advise these toilet substitutes to the patients and their caregiver. So in summary, urinary incontinence is not unavoidable with aging, but making changes to the lifestyle and gain control of your bladder, it actually helps to improve the urinary symptoms. So for now, I actually end my slide here. Thank you.
Thank you, Guoshang. So to the audience, as you can see, there are many things that need to be done and can be done to help patients with incontinence. What Sister Guo has just shared is, Sister Guo has just shared is about what we can do from the nursing perspective of improving not just control of the patient's urinary leakage, but we also worry about the problems that come with urinary leakage on these. Okay, so with that, I'd like to thank Guo Shang again for your talk. And please hang around to answer some of the questions later. And this now leads us to the last speaker of the day, Miss Maxine Ong, to share with us a little bit about what Tang, who have a wide range of dedicated continence care products, have to do to help all of you out there if you have problems with incontinence. Maxine?
Thank you, Dr. Lim. Just to check and ensure that everybody can hear me and see my slides.
Yes, very good.
Thank you. So first and foremost, a very good morning to everyone. I would like to start by thanking all of you for choosing to spend your Saturday morning here with us. I am Maxine, the product specialist for Tang, and I will be doing some sharing with you today. Now, we know that many associate bladder weakness as a condition of despair, since it greatly reduces one's self-esteem and confidence level. They then tend to stay away from their normal social activities in fear of embarrassment. Even at a modern time like today, incontinence is still a taboo subject for many people. Since it is a very private condition, many do not openly discuss or share their condition with others. For that reason, there have been many misconceptions associated with incontinence. So for today, let us break some incontinence stereotyping. So for the first myth is that many think that incontinence only affects the elderly. This is not true. Study shows that 1 in 3 women over the age of 35 will actually experience some form of urinary leaks, especially for those women that had undergone childbirth. This is due to the weakening of the pelvic floor muscles when they have a change in progesterone levels during pregnancy, which brings us to our second myth. Incontinence affects mostly women. Lo and behold, research shows that as many as 1 out of 4 men over the age of 40 will have a form of urinary leakage issue as well. Usually, it is brought upon medical conditions such as enlarged prostate or overreactive bladder conditions. So there you have it. Incontinence is definitely not a gender-specific condition only. The next myth is claims on not knowing someone with incontinence or bladder weakness issue. It was concluded with an estimated 400 million people worldwide actually suffers from incontinence issue. So it is very likely that there is someone you know who has this issue as well. The reason for the ignorance is usually due to the stigma attached to incontinence that makes most people afraid or embarrassed in speaking about their condition, regardless if it's sharing to a friend, family, or even a healthcare professional. Also, the misconception of drinking less water will help reduce the urinary outputs or leaks. It may seem like a good idea to limit what you drink when you have bladder problems with uncomfortable urine leaks. Most people want to try anything to prevent an accident. While this might help a little, it can also cause one to be dehydrated. Drinking less water not only makes your urine more concentrated, it will also affect the functionality of your bladder. Henceforth, it is important to ensure that you drink at least 6 to 8 cups of water daily by pacing the drinking intervals instead of downing large volume in one setting. Lastly, the fable on one with incontinence equates to them having bad hygiene. In actuality, by using the right product for the right purpose can actually ensure dryness and discretion to the leakage condition, as purpose-made products can help lock urine and odor away and thereby providing freshness, comfort, and good hygiene to the individual. Now let me show you a short video on what these purple mix products are.
Blue liquid, we won't be using that. Oh, lovely flowers. Go in, gone, and it absorbs instantly.
Okay, so to decipher the video, it is trying to convey that there is a difference between menstruation pad and urinary pad. Because there is a difference in urine and blood consistency, it is very important to use the right product for the right purpose. Menstrual pads are designed for blood absorption. They have porous top layer and usually have lower absorbency. On the other hand, bladder witness pads are specially designed for rapid urine flow absorption. It neutralizes the urine odor as well as reduce the risk of urinary tract infection and skin infection by keeping the top layer constantly dry. Furthermore, elastic barriers are utilized in urinary pads to further prevent these leakages. So for Tang barrier witness pad, it's developed to be up to 10 times drier than normal sanitary pad. All Tang discrete products give users triple protection from leaks, ensuring them to be dry with maximum comfort 24/7. Moving on to the severity of leaks, you will then need to select the appropriate incontinence pad depending on your leakage level. The severity of your incontinence can be characterized by mild, moderate, or heavy on a scale. Mild incontinence refers to spotting, like a few drops of urine leaks. So for ladies with such condition, you can actually consider the Lady Discreet Liners and Mini Plus range. For men, you can use Tang Men's Pad Level 2 pads. Moderate incontinence refers to leakage with about a quarter of the usual urine stream. Ladies declared normal, night pads with wing, and super range will be more suitable for women under this category. Similarly, for men, Tang Men Pad Level 2 is still recommended here as it can hold up to about 80 ml of urinary output. And for heavy incontinence, it refers to the full void of urine, which is uncontrollable. For those under this category, it is recommended for you to use either the tape or pants diaper. Pants diaper here are actually more suited for mobile users, and tape diapers is advised for less mobile users or even overnight usage. Tang diaper packagings are all color-coded for easy identification of the different absorbency levels. Regardless of your urine output, I am sure that you'll be able to find a suitable diaper absorbency with Tang. So Tang is dedicated to improve the quality of everyday living for anyone dealing with unexpected leaks, restoring their dignity and allowing them to get back at performing daily activities confidently and fearlessly. As you can see, we offer a full range of absorbable products and skincare solutions towards incontinence management. These are actually tailored to ensure that the needs of every individual are met with complementary products to nurse their skin back to natural skin health. In a nutshell, just to share some tips on how you can go about your daily living as per usual, even with bladder weakness issues. Ensure that you stay hydrated sufficiently with bladder-friendly fluids daily. Refrain from foods that may irritate the bladder, such as caffeine, coffee, tea, or even colas, artificial sweeteners, as well as alcohol. Include self-care activities like pelvic floor exercises into your daily routine. This can help prevent or control your urinary incontinence condition. And of course, using the right purpose-made product to embark on your everyday schedules. With that, I would like to close my time with a video sharing by our local artist, Lina Ng. She'll be sharing with you her personal experience on her urine leaks and how she actually managed her conditions.
It affects a woman's quality of life, and it's more common than most women think. Yet, many don't seek help because they're embarrassed. About what? Urine leakage. Yes, I experienced urine leak during my pregnancies, and it can be uncontrollable at times, especially during the second and third trimester when the bladder is under great pressure. A little movement, sneeze, cough, laugh can cause the urine leak. Well, it is kind of uncontrollable and uncomfortable. And then if I wet my pants, I have to go change a new and dry underwear. So I always have to prep a new set of clothes with me, or I will put on a pad daily. I also have to visit the toilet more often. And I remember once I went for sales, to buy all the baby stuffs, and there are a long queue of people waiting to go to the toilet. I have to queue up as well. So, while waiting, the leak just happened because I just can't control it any longer. As women, we go through different phases in life. We face stress, pregnancies, aging, and so urine leak does happen. And to me, I think that it is normal and it is common. So you shouldn't feel embarrassed or uncomfortable to address it. Well, to be frank, I didn't know that the ordinary sanitary pads are not suitable for urine leaks. It's only after I discovered Tang that I realized what I've been missing out on. I did some reading up and I found out that blood and urine have different density. So it's important to use the correct purpose-made products. I also found out that using the wrong products will not only lead to leakage, but also odor and even urinary tract infection. And I chose Tena as it is a reputable brand that is trusted by healthcare professionals worldwide. I immediately felt the difference when I first tried it. I felt so much drier and comfortable. Tena with triple protection is 10 times drier than the sanitary pads, with odor control and prevent leakages. And I like it that, they have a wide range of products with liners and pads for different occasions and needs. Like when I'm filming long hours or doing sports, I will choose Tena pads. Well, urine leak is a common problem. Many people experience occasional minor leaks of urine, whether they are young, old, or pregnant. Well, I know that it is an embarrassing issue, but we should be brave to face it and talk about it and find out the reasons to the urinary incontinence and get it treated and dealt with. Every woman has the right and ability to live their life to the fullest with freedom and confidence. This International Women's Day, learn how to manage urine leakage with confidence and courage and live your best life ever.
And yes, I've come to the end of my presentation. Thank you very much for your kind attention. Do follow us on Facebook for updates, or you can also scan the QR code to request for free samples of Tena urinary pads. If you have any questions, you can raise it up. If not, I'll hand the time back to the doctors for the panel discussion. Over to you, Dr. Lim.
Thank you, Maxine. Once again, thank you to all the audience so far for staying with us. And I hope you have learned something and enjoyed the talks. I would like to invite all the speakers to come back online. Ms. Rachel Tang, Ms. Chua, and Maxine. Of course, as I mentioned earlier, Dr. Shirley Bang is unable to join us as she has to rush off to attend to a patient. But we now open questions to the floor. Please feel free to pop your questions into the chat box so that we can try and answer any questions you may have. Of course, some of you may feel uncomfortable to ask those questions online. You may send them as an email back to us through the same email that you had received the link for today for this webinar. And I will try and direct the questions to the appropriate specialist or person in charge to give you a response, hopefully within a week. If you want to find out more about the Society for Continence, you may visit our society website. I must admit that I didn't put up a slide for this, but it's actually at sfcs.org.sg. Or you can search under Society for Continence Singapore. You will find a lot of information about the various types of incontinence. You may be able to ask us questions and we can help to answer some of your queries or direct you to the appropriate places. And I just want to say that at this point in time, oh yes, thank you, Rachel, for putting our website address there in the chat box. Society is made up of all volunteers. There are doctors, there are nurses, physiotherapists like Rachel, these are specialist nurses like Miss Jo as well, who are actually giving us their time to help people who have a problem, but we all know that this is not a topic that we commonly share. All right, let's face it, if you're at work, nobody has a cup of coffee or tea break and tells their colleague that they have a leakage problem. We don't want to talk about it. And the reality is, if you are sitting in a hawker center and you see someone stand up with a stain, you tend to shy away rather than walk towards them to offer help. But we can change that. And these people are not trying to harm anybody. They need our help. And if any of you are suffering from any problems dealing with incontinence, we are here to help. So I see a question here. Is weight a big problem if I suffer from incontinence? Maybe I can direct this question to Rachel. Is weight a big problem?
Okay, so I think I did mention just now that normal aerobic exercise is important. So I think we'll refer back to actually the evidence, which is for the normal BMI patient, actually weight does not play so much of a role. And that's also why I talk about relative strength. For those that are on the heavier side where your BMI is considered overweight or obese, then that's where weight will really play a large part in actually incontinence. For example, right, pretty much you can walk very easily if you weren't carrying something heavy. But if you were walking for like the same amount of distance, but you are carrying a 20-kilo fuel pack, that would be a totally different matter. So for those that are carrying a little bit more excess weight, they would definitely feel the pelvic floor would definitely have more strain on it than somebody that didn't. But as we mentioned earlier, it's just really one of the components that you can really work on if you feel that that may have something to do with it. It has plenty of other benefits as well, other than incontinence anyway. So if I would say if you were veering on overweight, you would really want to progress up to our advised 150 minutes of moderate exercise, depending on your medical conditions. So if you were having like musculoskeletal, back pain, knee pain, you would want to choose lower impact exercises. But if you were perfectly healthy, checked and everything was good, you're quite used to it, then not an issue to continue slightly more vigorous exercises in that aspect. I hope I've answered that question adequately.
Yes. To add a little bit to that, a person with a BMI above 30, meaning the average weight person has a BMI of between 18 to 25. It's a wide range, and that's because we have to accept that most of us are able to function very well within that range with minimal effects to our health. However, when the BMI is in excess of 30, the person's weight does put significant impact on the pelvic floor. You imagine that your pelvis is just a ring. It literally is a bony ring that you are standing on, but the only reason none of your internal organs fall out is because of these muscles in the floor holding everything together. If you put on a lot of weight and you press down excessively on those muscles, obviously the pelvis weakens. And as Rachel says, removing the excess weight improves not just your pelvic health, but overall general health.
Bisa juga.
I have
Tapi ini mau datang kemarin mestinya datang.
Somebody's on. Okay. I have a second question here is how do I get a copy of the Liquid Diary? I think they refer to how can I find out more about getting a Bladder Diary? Ms. Jo, can you help us with that answer?
Yeah, so actually Bladder Diary, I think you can actually get it online, which is ready available. But the next thing is when you do the Bladder Diary, who helps you to interpret the results and how to give you the advice is the next most important question answer. So if you have like you feel that you have some urinary issues, I think it's important to see a GP. I do see some of the GPs or even polyclinics level, they're able to provide the patient with avoiding diary, and they also can say advice and help the individuals with the urinary symptoms. Yeah.
That is true. Sometimes having a diary sounds like you have some control, but you need to be able to interpret it. And Ms. Jo is correct. So often speak to your doctor first, your family doctor or at the polyclinic, and they can then provide you with some information on the Bladder Diary and direct you to the appropriate person to help manage that problem for you. How can we help a person with stains in the public? I think for a member of the public, what we need to offer our fellow Singaporeans is empathy and understanding. They do not need us to treat them, but they need us to not shun them. And it is therefore, think of it as if that is you on the other side. And if you have the stain, you do not, but it is not something that you choose to do. It is not something that you want to do. And that you are, the role of the people around you is to not shun you and to treat you normally and to help you out if you ask for help. And I think that's what we need to do as Singaporeans to our fellow Singaporeans who are suffering from incontinence. I think some questions were asked specifically to specific speakers. Is there anything, because I won't see them, Ms. Joy, is there anything that that was directed to you?
I don't have any question on my side here.
Rachel?
I have two.
Oh,
I
yes,
think there's
please go
one
ahead.
earlier on where they were talking about after urinating and wiping dry, I have some leakage after leaving the toilet. Is this incontinence? It is actually part of a series of symptoms that you can experience when you are having certain sort of pelvic floor disorders or incontinence. So I would say that yes, the simple answer is this is considered incontinence as well, because it could be part of a incomplete emptying. The sphincter cannot close properly, and then after that, when you stand up with the extra intra-abdominal pressure, it can actually still drip out. So that is one of the reasons out of multiple. Then there's another one that was asked, which is how long per session must I do exercise? So I would say the general is that you do want to get in minimally 10 minutes per session to really get a good workout. But if you're, as I mentioned earlier, if you're really, really weak, 10 minutes would not be necessary because the muscle would already be fatigued already. So you would really want to see doing your set until you cannot do a good quality. And then after that, you rest, you do another 3 sets, which minimally would be about 10 minutes per session. So I hope that helps. Yeah, so I've answered the two that Doreen was asking for row C as well as the exercise.
Yes, I apologize. I overlooked that question earlier because the chat suddenly moved very quickly. Okay, there is a question here. Urine often 2 to 3 times a night between 1 to 6 a.m. Do I need to see a doctor? Do I need to do some tests? I assume, okay, from the name, I will assume that you're a lady. Now, whether you're a man or a woman, whatever your age is, passing more urine when you are supposed to be asleep, anything more than once is not quite normal. Of course, as we age, beyond the age of 60, our kidneys do not concentrate urine as well at night. And so when we are younger, we may be able to hold through a whole night of 8 to 10 hours of sleep without going to toilet. But as we age, we might find that you have to wake up once, maybe or twice to pass urine. That is probably at most as what we will accept as normal. But if you have to go more than that, then really something is going on. Now, it does not mean that you definitely have urinary incontinence, but you do need to have a doctor attend to you to figure out whether your problem is because you, one, drink too much water or maybe caffeinated drinks before you sleep. Number two, maybe an issue to do with your kidney. Maybe it has to do with other hormonal disorders, or it may really have to do with your bladder and urinary incontinence. It is very hard to say, but 2 to 3 times a night in that 5-hour time, you should speak to a doctor. Yes. Speak to your family doctor first if you're not sure who to speak to. Your family doctor will be able to decipher roughly whether the problem has to do with your behavior, your lifestyle, or whether it's your kidney or your bladder. And then they can direct you to the appropriate specialists. I guess we are actually running on with time. Now, I will want to thank the audience for submitting so many questions. Thank you, everybody. But if you have more questions you want to ask, once again, I want to say that you can send it to us. Okay, I will just guess we'll take this as the last question before we end the webinar today. As a question, is it safe to do surgery for urine leak and incontinence? How is it done and healing duration? Okay. nobody physically here is the urologist who's going to do the surgery. But as okay, I train in bowel continence, not bladder continence. But there are many different types of surgery for urinary leakage or urinary incontinence. It depends on where we find the underlying problem. Is it a problem of a bladder wall that is too sensitive? Is it a problem of a bladder neck that is too weak? Is the neck weak because the muscles are weak, or is it because it's unable to close properly for other reasons, for example, from previous radiation? Is it because a person is having menopause and therefore there is a change in the hormonal function on the urine passage from the bladder to the skin? We call it the urethra. Or is it an external problem? Was there injury before? So there are so many things. And as Dr. Bang alluded to earlier, it starts from simple things like chemicals we can introduce in the bladder, injections such as Botox or other tissue fillers that we can place in the bladder neck. We can even go towards all the way towards creating artificial sphincters, in other words, placing a plastic tube around the base of the bladder to tighten it, or we can do something where we can stimulate the nerves to the pelvis. And she mentioned stimulating, there's an outpatient version where we stimulate around the ankle to reactivate the nerve to the pelvis, or implanting a battery pack, almost like a pacemaker. If you imagine a person can get a pacemaker for the heart, we have a pacemaker for the pelvis. They're all different things, but each treat a slightly different condition. I guess the overall thing is it safe? Almost every one of the surgeries has a very good success rate with improvement in at least 80% of the patients, of at least 50% improvement of severity or more. And complications are rare. Rare meaning not impossible, but occur in fewer than 5% of patients with long-term issues. But no doctor wants to cause harm in doing the surgery. So the doctor will speak to you in a lot of detail as to which option is the most appropriate one for you and what the risks will be. Okay, as I want to end, somebody throws in another question. Yay, what food irritates the bladder? Maybe Miss Joy, you can help us a little bit with that.
Sure. So like foods that irritates your bladder sometimes are very spicy food, or even like acidic food like high citrus content, or actually generally also like drinks like high carbonated drinks and like Coca-Cola, soft drinks, and also caffeinated drinks. It depends on how much caffeine intake you take. Some individuals like they like double shot, espresso, all these are foods that can irritate, or drinks that irritates the bladder. They also say chocolates also sometimes do irritate bladders. It really boils down to individuals, like how they are how they are sensitive to the food itself or the bladder conditions.
Yeah, correct. So very often it's foods that contain a lot of caffeine or a lot of sugar. They both irritate the bladder dramatically. So if we reduce both, they are also good for the bladder. And we know that sugar overall, added sugar is not very good for our health. Okay, this will be the last question that we will answer. And the question is, can we have disposable pants, pads, or etc. for the public to teach them about how to help reach the sufferers? I think the issue is, can we help? How, as a member of the public, can we help incontinence sufferers? Are we able to find out more about the products that are available to them? Now, number one is you could visit I must admit that TENA's website, TENA, their website carries a lot of information on the various types of continence care products. But for the public, I hope that you understand that each time we choose a continence care product, it is chosen specifically with that patient's condition, lifestyle, and their beliefs in mind, that we tailor everything towards what they need. The society does try to help source for some of these products at discounted prices. The government also has an arm called the Agency for Integrated Care, that helps to look into this, and we, the society, do frequently work with them to find out how we can support the people who are suffering. If you don't want to read on the website, I would suggest you go walk into NTUC Extra. You walk through the continence pad area, which is usually right next to the children's diaper area, and you will find a wide range of products. The truth is that if we don't look, sometimes we do not realize. And there are many things that we can learn from there. But the most important thing as a member of public that we can do is to show our compassion and our empathy. And with that, I would like to thank everybody for your presence today. Thank you to all the speakers today. Before I end, well, I guess as a president of IPC charity, I hope that you had learned a lot from the talks today, but I also hope that you can help us help our sufferers with some donations. The society, now, this is not a must, you do not have to donate, okay, but it will be helpful for us to be able to help incontinence sufferers. We are an institution of a public character, which means that any donations to us will be eligible for 2.5 times tax deduction, as all other IPCs. We will leave this slide up. You can donate to us through the PayNow QR code. We will send you a tax invoice. We will need information from you on your personal particulars in order to enjoy the tax rebate. Once again, I want to thank everybody for your attendance today. Thank you, because now you take the first step to help anybody else with incontinence. Have a very good weekend, everybody.
Thank you, Dr. Lim.